My name is Dr. Bruce Fishman, and this is both a friend and a patient of mine. His name is Roy. Roy owns a tire store and has worked hard his whole life. As a result, he developed some bad shoulder problems, bad knee problems. At some point, an orthopedic surgeon elsewhere told him he needs a total shoulder. He came to me, and I told him, wait longer. Everything else except your shoulder joint looks good except for the cartilage. Maybe in the future we can use stem cell. Years later, we talked, and I told him stem cell was now available to help his shoulder so that he didn't have the pain and problems and functional problems he did. So we talked about stem cell, and at that time we gave him the option of taking his own stem cells from his adipose tissue here in his stomach. And then that special stem cell was both isolated and concentrated, and then we could, after it was harvested by Dr. Unai, a well-known plastic surgeon in our area, the stem cells were then given to me, and I deployed them to both knees and to, was it just the left shoulder?
Just left shoulder.
And the left shoulder, which was his real problematic shoulder. He really came in doing this, couldn't even get his hands up. If you see now, both knees. He gets them up in the air, which could not do before.
And behind the head.
That was not possible for years for him. Also, he was able to go hunting. He can walk downstairs without grabbing onto a railing, hoping he's not going to fall. He walks regularly now, and you've heard him tell you all about that.
I'm going to ask you a question, Roy. I'm sure you were a little reluctant about stem cells. What were you afraid of at the beginning?
I wasn't afraid of the stem cell. I was afraid of getting the shoulder replacement. The stem cell was an option, and I took it because I have confidence in the information that Dr. Fishman told me and what I could read up on the internet.
And did you read about different types of stem cells? Or did Dr. Fishman tell you about different types of stem cells?
No, he just said we were going to harvest my belly fat, use my own stem cells to inject it into my knees and my shoulder. You know, it wasn't going to be an umbilical cord or anything like that.
Why did you go to Dr. Fishman?
My primary doctor recommended Dr. Fishman as a second opinion. Because the first gentleman that I seen, the orthopedic surgeon, said I need a total, shoulder replacement and wanted to schedule me for that following week. And, me going in there thinking I just had a bad rotator cuff, I needed a second opinion. That was very hard to swallow.
How do you like Dr. Fishman as a physician or as a person?
Dr. Fishman is the best. He's kind, courteous, professional. He tells it right straight how it is and tells me what he thinks he can do for you.
Now, having had stem cells, would you ever recommend this to somebody else?
Absolutely. I give out his cards at my tire store and tell people about my experience and what it's doing for me.